3 amazing advocates here today with me, whom I personally adore so much. Like all of you in this room, they're not only out to help themselves and their family, but they work in their daily lives to also help our families. So I just think they're so cool, and you're gonna love them. We have a medical professional / wear mama perspective. We have a super powerhouse caregiver in the middle, and then we also have the patient perspective. So we're hoping to foster a great little discussion, and hopefully you can take some actionable steps home to help coordinate your complex care. They wanted me to be a participant in coordinating complex care, but I'm like the poster child for uncoordinated care, so I know a lot of you are too, so we can sort of relate there. But I'm going to let them introduce themselves. This is Nicole Glenn.
Hi everyone, thanks so much for having me. I'm Nicole Glenn, I'm a pediatrician. I live in the Bay Area with my husband and my 2 kiddos. I do general outpatient primary care, and rare became our lives. Our daughter, Rosie, who is gonna be 7 next month, was diagnosed with, there she is in the middle, well, all 3 of those are her, a rare disorder called HNR-MPH2. It's a neurodevelopmental disorder that is sort of similar to Rett syndrome in that kind of field. And we got our diagnosis in 2019. And so everything changed, and obviously a huge part of our lives now has become advocating for her, learning about her disorder, and figuring out how we can help this whole community. We were really lucky when we got our diagnosis. There was already a patient foundation. The Yellow Brick Road Project is the patient advocacy group, and so we were so fortunate to have found them and have become very active members. My husband's on the board. We flew to New York like 2 weeks after we got our diagnosis and met with other families, which was awesome, and learned everything we could. And so being her mother has really changed my perspective as a primary care provider, as a pediatrician, in terms of how I think about my patients and what it means to coordinate complex care, what it's like to be on the other side of the table. So I think that I try to keep that perspective in mind, and would love to share some of my thoughts around coordinating complex care with you guys. So, and thanks, then the little 4-year-old, and that's my almost 4-year-old too, Jack. He's a little firecracker. And then here we are. This is the Yellow Brick Road Project. We do our family meeting every year, and in Florida, it's a great time. I love connecting with the other families. We're a really motivated group of parents who are really working on treatments for our kiddos.
Hello everyone, I'm Parvathy Krishnan. I am mom to 2 children with medically complex conditions. Much like you, we decided early on, cutting our diagnostic odyssey really short. Our journey started in 2014 when my then son was 6 years old. Since then, we've had 2 children with multiple medical conditions. We are that family, much like many of you may relate to. We go where we have to go to get the care that we need to get. And so while home is North Carolina and we absolutely love it, we realized that for our nucleus, our little family, that wasn't enough. And so we ended up needing care for both our children. We've been to Cincinnati Children's, Boston Children's, Living Children's, which is 2.5 hours away. We used to drive twice a week with my daughter. Our experience with complex care started when we realized that we had 2 very medically complex children, and that it wasn't just enough visiting every single specialist. We needed a parent home. Just like we were caring for both of them, we needed a medical team that would care for all of us, and that's what started our journey with complex care. We also ended up transitioning to palliative care and hospice care with our then 4-year-old daughter who passed away. And so I'm here to share our journey and everything that we have experienced to hopefully help others not face what we faced, but also make it easier.
I apologize if your slide doesn't show up, Kristy. It didn't populate,
all right.
So let's just see. Oh, it's not here. Okay.
All right. So hi, everybody. I'm Kristy Dickinson. I am a rare disease patient. I live with Ehlers-Danlos syndrome and mast cell activation syndrome. And just because I'm a lottery winner, I also have ankylosing spondylitis and psoriatic arthritis. So complex. And we're not going to talk about the diagnostic odyssey, but like a long time to get my diagnosis. And then a long time to figure out how many specialists, who's going to be involved in my care, and then to get everybody talking to each other. This is a topic that is very near and dear to my heart. I am a vocal advocate for patient engagement, patient experience, patient empowerment, all of the patient words. I love having a physician on our panel because you guys really are the quarterbacks to our care. But in a situation, oh, sorry, I talk with my hands. In a situation like mine where at times patients don't have that quarterback. So we have to become that quarterback, and that's really been my experience. My healthcare is divided across 3 hospital jurisdictions and 11 different specialists in Canada. Center of Excellence, community hospital, and then tertiary care around. So thank you, Effie, for having me on your panel today, and I'm very excited to chat with you all.
Yes, awesome. Okay, I was so excited for you to meet them. I forgot to tell you my name, so I'll do that really briefly, and then we'll start talking. That's me. I'm Effie Parks. I have the privilege of working at Global Genes, so I get to meet so many of you all the time on the reg. I also host an amazing podcast called Once Upon a Gene. That's my little buddy Ford. He's so cute. He just turned 7. He has a neurodevelopmental disorder called CTNNB1. He's doing great right now. My other picture's gone too. Okay, I was also gonna show you all the CTNNB1 kids. They're also my family, along with all of you in rare disease. And I'm just so happy to be here and talking to all these girls. Okay, so we're gonna get down to it. Nicole, anytime there's a doctor that comes on board, I'm like, I'm sorry, but I'm so happy you're here. Me personally, I really just try to find a pediatrician that sits down and says, I'm just here to do whatever you tell me to do. Like, that's what I'm looking for. I know that's not necessarily realistic, but I personally just use my pediatrician to write my referrals, and I call them and tell them what I need, and they do it. What else am I missing? Like, what role can a primary care provider, a pediatrician, like, offer families other than helping me get my other appointments quicker and easier?
That's an excellent question. I think it depends on the disorder, obviously, but I think sometimes your general pediatrician can help you think about what else am I not thinking about, right? Like, I think sometimes patients come to me and have some specific questions. I'm like, well, that's really a question for your specialist, but I would also ask this, right? So I think sometimes it's just someone to be a good sounding board and think about who else should I get involved? Who else should I have on my care team? So I think that's the piece you're missing. And because I will sometimes say, oh, I wonder if we should ask rheumatology to take a look, or I wonder if we should, because I don't know. As a general pediatrician, or a generalist, you know a lot about things, but you don't know like the details. So I feel like I'm supposed to know lots of different things about disorders, but I can't dive into every single one. I'm not the specialist, and your primary care provider is not your specialist. But they can kind of figure out, like, maybe there's other answers here, things that they're, so I think that's where their perspective is really helpful.
Yeah, so you really just need some time and talk shop and just have them like brainstorm with you and really jump on board. Yeah.
Right, and I think they can also help you kind of think about the coordination if you need to, right? Like, we have to have this done. What else do I have to have done? Can I group things together? How do you, especially from my perspective, a lot of times I'm trying to figure out how to reduce trauma for kids. So how can we group procedures? How can we do things all in one so that we don't have to subject kids to multiple blood draws or multiple, appointments at the same time, or just what those resources are. Like, if I have a family whose kid is really complex and they're getting care, I'm like, do you know that this resource is available? So I think just kind of exploring resources is something that your provider can tell you. They should know what's in the area, hopefully.
Yeah, okay. Parvathy, this one's to you. You are on a plane almost every time I talk to you. You're traveling around all the time getting care for Yash. One, how do you do that? How do the two of you do that? And what is the importance of you facilitating that medically complex care coordination to help you go from place to place to place and keep them all in the loop?
So I just realized I never spoke about the condition my children have. Between both my children, there were 5 genetic conditions that we now have established, which itself seems like we should be at the Hall of Fame for genetics. But that being aside, I think my son, who's alive today, has CMMRD. It's an ultra-rare condition. It's a cancer predisposition condition he will keep getting repeated cancers throughout his life. He is 15 years old today. Well, not today, 15 years old, and he has had 5 different types of cancer. If you Google any one of them, that particular cancer is ultra rare. So we learned pretty early on that after we got the diagnosis, we said, okay, who's in the state of North Carolina? Where are the experts? They said, nowhere. I said, where in the US can I go? Because, where we told you already, we're the family that goes where we have to go. And they said, oh, we no one in this country has this particular gene mutation. We're like, okay, that's fine. Where in the world can we go? And they said, your child's the only one in the world with this particular gene mutation. We're like, thank you. We came to know that the specialists, the consortium for clinical research, for clinical care, the one that puts out guidelines for this condition is in Sick Kids Toronto. So we called them and we said, we're gonna fly to you and you can care for our child. And they said, no, we're doing lab research. We are also physicians, but don't just show up here. There's really nothing we can offer you that your doctors cannot offer. And the way our consortium works is they want to empower physicians and teams around the world to care for patients like us. And so they said, please do not come here, but we will get on this call with your medical team and help you figure out what's going on. And I think that sort of empowered me to say, okay, we're not going to find a specialist that is going to know what my son has, that's going to give me the exact roadmap of what my child needs. And I think it also came out of the fact that our daughter, when she was alive, saw every single specialist except OBGYN, and she passed away when she was 4 years old. And there came a point where we said, how many more appointments can I fit, especially because we're traveling to Living Children's 2.5 hours away twice a week to see one specialist. It was a combination of all of this, the fact that we were visiting 3 different medical centers, and we were fortunate that they all were connected through Epic, that we could at least say like, oh, we saw this doctor yesterday, so pull up that note, but that is not the case for most families. We realized that we needed a home that said, okay, 4 different doctors are telling you 4 different medications, but no one's really talking to each other to say, is this still safe for your child to receive? And that's how we were introduced to complex care. I will be loud and proud and say I believe that UNC Chapel Hill has the best complex care team in the world. We have now learned more and more that they're doing amazing work, but I think the reason I love them so much is they were the first team when we walked in with a problem. Obviously, we were like, we have 2 minutes. This is what, we know you're busy. We understand. This is the problem we needed to fix. And the doctor just said, how are you? And I'm being the mom, I'm like, I'm fine, we're here to fix this problem, like, this is what's going on. And they said, no, how are you? I promise you we'll take care of your child today. We will fix the problem you came here for, or find what we have to do to take care of your child and make them comfortable. But how are you? And of course, because of gaslighting and because of medical trauma, I kept thinking, is this a trick question? Is he going to say, gotcha? And I just stared at him and he said, I just want to know, how are you? And, did you have coffee? Anything I can get you? And that's the day I realized this is how medical care should look like. This is who I want on my team. And that was the day I told him, I was like, you're it. I'm always going to come to you. You're going to get thousands of medical records from everywhere that we go. And you're going to be the team that I come to. And they empowered me to say, it doesn't matter where you get care. We're always going to be your home. So do what you have to do. Reach out, find out whatever specialist says, come back to us, and we'll help you figure out what you really need to do. And I think that we're fortunate to have those kinds of teams and have that team that says, go to any specialist you want. We're not the specialist, but we're here for you when you come back to help you.
So you created a home base. We did. And then you go and do all of your work.
Yes, yeah. And now we have many home bases, because I also realized when we go to Boston Children's and we spend months inpatient that our doctors at UNC cannot be as impactful. And so we're that team that walks in and says, if my child's getting surgery, I need your palliative care team on our team day 1. And they're like, no, your child's not dying. I'm like, I know my child's not dying, but that's not why I want them. I want them because they get us. And so every time we have a big admission that we know, we ask for the palliative care team, and now they know that they will expect us and that they are going to help us decide the best care for our child.
Kristy, living as a patient, can you describe your experience of navigating your own complex care and having multiple specialists?
Yeah, you're right. Doctors really don't like it when you just show up, because that does not work. There is now a Center of Excellence partnered with Sick Kids at the Toronto General for EDS. That was not the case when I was diagnosed. And I think like all of us are here because we've been touched by rare in one way or another. So we all know that finding a physician that has an interest in your diagnosis is like hitting a gold mine. And if you don't find that, then you need to be I guess, gentle but firm about needing someone to take on that role. And the Canadian healthcare system, you know, your GP is supposed to be that person. And I use my GP like Effie uses hers. Like, I don't want to take up all of your time. I know how precious your time is, so I just go in with like, hey, I need this, I need this, I need this. And that's okay when I'm well, but when I'm in crisis, I'm missing that person who can connect the dots. Our hospital, like, we are not all on Epic. Records go missing, appointments get lost. I forget what medications I'm on. If my husband doesn't have the up-to-date list because I changed something, then he can't accurately, you know, retell that history. So there's pitfalls that impact patient safety all the time because our system wasn't built to be collaborative. We live in silos. So I think if we could have, like, what you're describing is ideal. Getting into complex care for me has been a challenge. I'm still really managing that. And you know, like I said, when I'm okay, it's fine. When I'm not okay or I'm in a time of crisis, that's when the wheels have a tendency to fall off the bus. 11 specialists in 3 hospital jurisdictions is a lot when the game of telephone is so broken. So it's just a lot of juggling.
Yeah, you know, I don't want to make this a digital health topic, but just speaking of EHRs, Nicole, I don't know if you can speak on this, but how can families go home and best utilize that tool?
You're lucky, like Parvathy is saying, if you live in a place and where there's multiple systems and you're accessing the ER, it can be super helpful. I say with my daughter, we go to multiple different places because I get to cherry pick sort of who I like, so I don't feel like I want to stay in one system. But the EHR can definitely be your friend, and at least in California, now everything is available. So even like the physician's notes, and so that's been very interesting for me on both sides of it, that the notes are available. So I can go back and read exactly what the physician said, and it's helpful for my daughter. My patients can do it with my notes and things, and so you can see exactly what they wrote. You have access, hopefully, to all your tests and things, and so your problem list is right there, all the things that your doctors are keeping on there. So I think one thing that I was actually just sharing with one of my complex kiddos that I manage, mom was like, I feel like I have too many appointments, I have too many things to do, it's so hard to remember. And I was like, you almost need to create your own little like mini EHR at home. Like, what are your kids' issues? Who are your specialists? Like I have, when I look at a patient's chart, I have like a little snapshot of like meds, problems, like sort of the highlights. It's like, you need that. And then you need to say, here's who I contact for this. This is my next appointment in 6 months. Like, and so I was like, start with the medical record too, and you can look through and go back at the notes and see when did they want you to come back. And so I keep thinking more about your first question, like what can your doctor do? Like, I feel like that's something I end up doing for families when they come in. I'm like, well, what did the specialist say? And then I'll pull up the note and say, well, they wanted you to come back in 6 months. Did you know that? And they're like, no. So, but they didn't realize they have access to it. And I was like, so go, if you can do that, then you can look at your notes and see what their plan was and their backup plan. And so I think sometimes that's another thing that families don't realize is a resource for them. Mm-hmm. I also think that sometimes, like, when you're in crisis, I think something that you can also go to your GP, hopefully if you have someone who can help you, is kind of coming up with a crisis plan. Mm-hmm. So I have some families that, you know, we try to figure out, okay, when this symptom happens, who do you call, right? And sometimes maybe that you need someone to troubleshoot that with, like your complex care team. So if it's bad, should I call you or do I call GI? If I'm not sure what it is, so I go to you first or do I call neuro, right? Like, because when you're sick, sometimes it's multiple different things. And so, sometimes patients do come to me and I'm like, you got to call neuro. So, but I think at least then I know what's happening and I can help figure that out. Or maybe I can call neuro and say, this is going on. Do you want to see this kid now? Like, what's happening, right? So I think if you utilize your pediatrician or your general practice doc or whoever your go-to team is in that way, they can kind of help you in crisis mode, crisis plan.
I think I've 3 memories of texting you in the middle of the night and doing just that. So thanks for that free work. And I know you're doing that for a lot of your patients. But that's a really good idea to kind of have maybe one of those appointments with your doctor and make that mini plan so you can just at least like kind of have that at hand when you don't have time to really think and focus through it and just take the actions.
Yeah, I think the contingency planning is key. Because you can't think in the moment, you're so stressed, what do I do? And so, you know, who do I go to? And I think understanding sort of when do you need to escalate things versus not. Like, you know, sometimes another question is, well, when do I go to the ER versus when do I just call you, right? Like, my daughter has a seizure disorder. So I asked our neurologist, do you want to be notified when she's got a seizure? Like, should I text you? I mean, I have her number, but I could go through the route and call her. I said, do you want to be notified? Do I need to tell you, right? Like, so what are the next steps? And I think that helps so then you don't feel so lost in those moments.
Yeah, I feel like you could give us all a top 10 list questions that we should bring into our doctor after this is over. We'll email it.
And I just want to add to that. I think one of the things, I mean, there's so much that we do as advocacy organizations, but I think to empower patients themselves, one of the things you can do is work with your medical team. There's standardized order guidelines everywhere, especially in the hospital system, that get triggered. So for a family like ours, that my son has a bleeding disorder and he gets a procedure every 3 months. Now, it would be tremendous work for me to go from North Carolina to Boston just to meet the specialist that I know is going to trigger a standard set of orders. So we had a meeting and we said, every time he has a scope, can you just put it in? And so pre-op knows it, the operating nurse knows it, the doctor knows it, no matter what, when he comes in, he's going to get a standard set of labs, he's gonna get a standard set of medications that he has to get to prevent it from becoming a crisis situation. And I think the orders go to CVS automatically, so once his procedure is done, I have to walk down and for the next week, he has to take this bleeding disorder medication so he then doesn't bleed. But it happened after he bled 2 liters in the ER when we went back and we were saying something's really wrong, and they were like, he looks fine, his labs are fine, he just got discharged 2 hours ago, and that was not okay. And so it was that event that then led us to say, if we ever come back and say, my child is having some blood, please take us seriously. And that's when the hematologist said, we're coming up with a plan so this never happens again, or at least minimize the effect that's going to happen.
Yeah, yeah. Kristy, I know you have a lot of experience with centers of excellence, and I'm sure there's some good and not so good experiences you've had. Can you tell us how some of those have worked well and not so well?
Yeah, I think with the Center of Excellence, if you're newly diagnosed or if you're referred to a Center of Excellence, and I can't speak from the caregiver's perspective, so I'll just give from a patient perspective. I went in and I was like, this is awesome. They have everybody in one place. They are a Center of Excellence for my disease. This is going to be fantastic. And what I didn't take into account is these are all just human beings that have come together that are all still learning. And so managing expectations going in would have been helpful, in hindsight, having gone through the onboarding of a new Center of Excellence. I realize now, okay, had I been not one of the first, if I'm post, 10 years, they've got all of these learnings and they've seen so many more patients with my diagnosis, they probably would be that main hub for information. But the experience that I had was, I felt almost like a test subject because I was one of the first to go through. And that happens often with us, right? Like if you're meeting with physicians or specialists that haven't seen, and you would know this better than I would, ultra rare, if you're the only kiddo with that, they're learning with you in real time with you. And it is much like the conversation that started us off today in the keynote, we're doing the work now for people 15, 20 years from us. So I think centers of excellence are incredibly helpful if you have the proximity to get to one. So if you win the geographic lottery and you can get to it, and if they've been in an established center of excellence for a while. So they've got physicians that have the fulsome understanding, or they manage your expectations going in. You're going to be able to find some good resources and a good, hopefully, additions to your care team here, but don't be surprised if you're still educating and if you're still sharing, because none of us are the same. Even with the same diagnosis, none of us are the same. So I think just managing expectations would be the advice that I would give when it comes to centers of excellence. I think they're great. I think if you have a diagnosis with a large enough patient population to support one, and the physicians are taking the interest, that's where the research often comes out of, right?
We also talked about, could you jump into a center of excellence? So we we had learned early on with HNR and PH2 that it is really similar to Rett syndrome because a couple of our kids got diagnosed with atypical Rett. Rett syndrome is typically the same genetic mutation, but there's clinical criteria. And so there were a few kids around the world who really met the clinical criteria but did not have the gene. And so they got this atypical Rett diagnosis. And then once we got whole exome sequencing, they're just kidding, it's actually this other thing, HNR and PH2, which is really similar. So we don't have centers of excellence. There's only about 130, 150 kids with this disorder. But we've been trying to kind of like slide in under the Rett centers of excellence and sort of get some recognition. Luckily, we've got some great researchers that have kind of noticed these similarities, and so we've been interested to see. I don't know if none of the patients in our group have done that yet, but have said, could this be beneficial for us? Should we be trying to be seen at a Rett Center of Excellence because at least they understand sort of the complex nature of this NDD, of this neurodevelopmental disorder? And so I wonder how often, if there's other, I would love to see just an NDD Center of Excellence or something, right? Where people are like a rare Center of Excellence, just, people who understand sort of this life, but can you kind of try to figure out where else you fit under when you don't fit anywhere?
Yeah, I think we're always trying to like ride the coattails of someone that has a bigger reach and like where we can fit in there because we do like have more power in numbers, right? Yeah. Parvathy, I know that you're just a natural storyteller and you're so funny and you have so many experiences that I love hearing about. So I'm gonna put you on the spot and ask you for maybe a particular instance or story that you have where collaboration among all of your amazing healthcare providers that you have really made a difference.
I think initially when one of the first things that come to my mind is this really, really long admission that we actually had at UNC where my child was in the hospital for 3 months and we had 2 children at that time receiving really high level of care. And it got to a point where we did not agree with the care or the plan that was being presented to us. It took a lot for us to say, we love you, but we're going to go somewhere else for the care that we need. We went to patient relations. We had to fight the fight, even though we told them, we trust you. And it came down where I then had a talk later with them, and I said, I'm the parent, or we're the parent. End of the day, we have to go to bed knowing we have done everything possible for our child. And if that means going somewhere else and them telling us that this is the exact same plan that they're going to do, that's okay with us. We would rather go there and do that. Even if you're telling me it's the exact same plan they're going to tell me, we need to be having that conversation with that team. We're not saying they're miracle workers. We don't think that we're not trying to cure the situation. We just want to make sure we have explored all the options. And the team that came to our support and helped us actually navigate that was the palliative care team, where they said this family needs to go where they need to go to get the care that they need to get. And when we finally made it happen and we were leaving and we were getting discharged, I turned back and I said, just know I'm coming back here. You are still going to be our doctors because this is home, but you always need to remember as a patient or a caregiver that we need to feel like we have done everything in our power. And today, as a parent who has lost a child and a parent who's trying to keep the other child alive, you never want to regret the decisions that you're either being nudged to take, because no one forces you to, but you never want to, even as an adult, regret the decisions. The power is always in you. And so you need to find that voice, or you need to find a team that just blindly says, okay, if you want to go somewhere else and that will be better for your family, for your mental health, and just for you to care for your children, then you need to do that. And I think that was we then went on to Boston and stayed for another 4 months, and so it wasn't easy, but it was something that we had to do, and we'll do it again if we had to. And I think that it was a very difficult decision because there's a lot of egos involved, and we're talking about research and science, even apologies, even in the medical space, there's a lot of ownership because you're our patient and we want to fix you and we got this and we're the best. And I'm like, I have no doubt, but you know what? It's okay, let us experiment. We're not doing anything detrimental to our child. We're just taking him to another center for care. So I think that there's a lot that you have to deal with as a parent or a patient, but I think in the end of the day, you have to always think, will I go to bed? And will I feel like I've done everything? And if you feel like that there may be a maybe there, then you have to find what you have to do to go to bed and sleep. we barely get sleep.
Yes.
So when
I feel like this is the beginning of your TED Talk, Parvathy. I think that's a great topic. And yeah, it takes a lot of guts. It takes a lot of guts to move on to a different provider. And quite frankly, a lot of people just don't even know they can do that. You know, it takes a lot of appointments and a lot of like getting involved in advocacy to know that like, next, you can do that. And sometimes it's the best decision for your family and your mental health, like you mentioned, which let's touch on. I'd like your perspective as a patient and managing all of your care and kind of what tools you've set in place for yourself to do that. And also I'd like your opinion too, Nicole, of how you help coach families through that now that you're also a rare mom and like how you're kind of helping everyone navigate that. But Kristy, I'll start with you.
I think a massive gap in our healthcare system is the lack of, like, to me, if you get a life-changing diagnosis, you should also get some mental health support in that minute. And whether or not you take it, like no one, again, you don't know what you don't know. And so you don't realize the second that like, oh, I've got this condition now and my whole life is going to change. My child has this condition. The life that I imagined is not going to be our reality. And so you go into like, I guess it's fight or flight. And so you're fighting and you're going and it's only kind of after the dust settles, if you can find a plan, or if you're lucky enough to have a treatment, or if you have a breakdown, that you're like, oh, I've got some stuff that I need to work through. I will talk all day and every day about the benefits of therapy. I think everybody needs a therapist, and we've got like a crisis. And I can speak for Canada, but I'm pretty sure the US has the same crisis, that there's just not enough mental health supporters. So it's a lot. It's a full-time job to manage a complex health condition. And then you throw on that, I have 3 kids. I try to work. I advocate, which also comes with a heavy burden of supporting the communities that you're a part of. So, you know, to think that this wouldn't impact your mental health, I think is silly. And so it's, you know, you can get upset at the system, but then I'm like, all right, what is in my control? Well, how I react to it. So I exercise when I can. Ice cream, that's what I eat. I probably shouldn't. But like, you know, talk therapy, CBT, all of the things, whatever, find your thing. Education, for me, I get comfortable when I know I need a plan. I hate not knowing, which, you know, I think rare disease, you're not gonna know. So maybe finding a way to be accepting of that. I just think mental health is not talked about enough when you're given a diagnosis.
I would totally agree. I think naturally, I always did that a little bit with my patients, but it has definitely changed since having Rosie. I think part of my office's like routine protocol for when like babies come into the office is to check in with moms for postpartum depression. And I always tell moms like, you get to see your OB at 6 weeks, and they say like, you're good. And you see me all the time for the next 2 years. So I'm always, how are you doing? And the amount of moms that cry in my office, and then sometimes the dads are like, why aren't you checking in with me? And so I've changed now. I like try to check in with dads too, like, you doing okay? So I've always sort of had that piece, but then having my daughter really sort of, I was like, you know, just the load that families are carrying and the fear and the worries. And so I try to do a lot more of that with my complex families too. And I can always tell when someone's kind of too okay. I'm like, that means you're really not okay. Like when they come in very like, no, I got this and I'm doing it. We're fine. I'm like, are you sure? Are you sure you're fine? Because we all put on that armor, and I think I do that. I think about the first time I went, my daughter had her seizure, and everyone's crying, my families are panicking, and I'm like stone-faced cold, like we do this, we do that, we're in the ER, and you go into like, fix it, I got this mode, and you emotionally block everything so that you can think. And so I hate making my patients cry in the office, but I do try to like get in there a little, and are you okay? Do you have support? What are you doing? Like, you should talk to a therapist. And I think agree with you, people don't talk about it enough, and I waited too long. I started therapy about a year ago, and it's been so helpful, and I waited way too long, and I was like, I'm a healthcare professional, I got this, I don't need it, and wow, did I need someone to talk to about all the things. And so it's been so helpful. And I think talking to other families is the other big key thing, because I think that's where you find, we found so much support with Yellow Brick Road. I mean, we are so lucky that we have such an active Facebook group, and learning about it's been helpful medically to know like what I should know. Like we learned that cortical visual impairment is from one family, that this is something that we should be thinking about, and so now everyone's getting screened for it. But just the emotional support, and hey, my kid had another seizure, can I call you? I'm just feeling stressed, and having someone else to talk to. And so I think like that social, like so I try to get my patients to reach out to other patients so that they don't feel so socially isolated, that this is socially isolating, and you need to talk to someone else who's been through it and can give you the hints that your doctor doesn't know. What services are available? Is home health an option for you? Things that maybe your generalist doesn't know. My colleagues now come to me sometimes and ask me that kind of stuff because they were like, what's IHSS? What can my patients get? Because I've done this. But without Rosie, I would not have known any of that. There's no caregiving class in med school. It's not like anyone taught me how to teach people this. And so you learn these things from talking to other patients. But I think we get sucked into our own, like wrapped up in just the day-to-day, and we forget about sort of how important that community is. You through. It takes a village, and sometimes your village is not physically there, but maybe they're online, maybe it's you texting me in the middle of the night.
I do it a lot.
So I think that's important.
And I just want to add, Effie, if you don't have a community or if you don't have a group, it doesn't mean you should still feel isolated. All of us in the rare space have something you will find similar to what we're experiencing. So it's not the exact condition, it's not the exact specialist, it's not, you may never find one, or you may be waiting forever to find one. So just reach out to any rare person here that you see. I'm sure there's at least one thing you both will be able to vent in common. And that may be the only therapy you may need for that day, but you can find your person no matter where you are.
Yeah, I'm so glad that you guys brought this all up, because I think that we forget that that is part of our complex care coordination,
Absolutely.
right? Not only are we the administrators of our child's health or our own health, but like we have to pay attention, because if you're driving this bus, I mean, you have to take care of yourself too, right? Yeah. We just have about 7 minutes left, so I will open it for any questions if you have any. Otherwise, I'll just continue to let these ladies talk. Blythe.
I just want to, Nicole, right?
Yes.
I really want to, sorry, this is for the last again. I'm a parent of a child who had a very rare condition, and her primary care doctor was her specialist, actually. And I just think that we should always begin with the pediatrician. And even if your pediatrician is primarily referring you out to specialists, that can be the home base, because they're looking at the whole family and the siblings, and they are more likely to ask mom, how are you doing, especially if you don't have a coordinated care clinic in your area, because their job is to take care of the child, which means to take care of the family. And so I do think the pediatrician is a really important button to push, and if your pediatrician is not doing it for you, go find another primary care pediatrician. And then there's an opportunity to educate your primary care pediatrician so they are more curious and supportive of their rare disease kids, instead of trying to just ship you off to the specialists. That's my push for Mark. Yeah.
I would definitely agree. I mean, even just in our patient group, one of our members was like, we're struggling with this symptom. Should I go see this specialist? And I said, well, go see your pediatrician first. And they were like, well, why aren't they? And I was like, because we can do some things. Like, I can rule out some basic things, like, rare kids have general conditions too, right? And so at least, and I often tell families, you want to make sure you go to the specialist and not be starting at square one. So make sure you've done kind of the basic things you can with your doc, and then you want to go see the specialist. So at least then they're not making you start with like some, even for, most of my patients are not super complex, but even if I'm sending a kid with chronic runny nose, like if I haven't tried Flonase, and ENT's gonna tell you start Flonase. Like I don't want you to go there without having done the basics. So I think, thank you for that plug, I agree. And I think different health systems have different time. I'm really fortunate, I work in a system where I can adjust my patient time, my appointment time. So some of my complex families know now, and I said, look, when you book online, you get 15 minutes with me. If you want more time, email me, or call my nurse, and they will book you a 30 or 45-minute appointment. Fine. I don't want to rush you, or I'll have them book the next appointment at the front desk, and I will write down, please book them 45 minutes. But not every doctor has that privilege. Like it's some systems, especially if you work in a system that's more kind of regimented. Like I would think about like Kaiser, for example. Like we have a Kaiser doc that just joined us, and she says it's really hard to make the adjustments, but it can be done. So you just have to know what to ask for.
Hi, I'm a primary care physician, internist, and a mom of someone with rare disease. And I've had to pivot my career in the last year to move away from primary care, just managing my son's complex care. And I did work for Kaiser for 12 years and did not have the privilege of having 3 slots for a patient. So I guess my question would be that, because that is becoming more and more the more standard of care for most people, for most working people, is do you have any advice for shifting the narrative or changing that system to account for more complex care?
Do you mean like more from
From a system standpoint, from an advocacy standpoint, to be the patient and advocate or ask or demand for that, because I am also a Kaiser patient.
Right.
As are many people in Southern California.
The systems issues for me feel so overwhelming because I'm part of the system. So I think we do need to see that change. And I think that there has been some improvement with telehealth too, to be able to like kind of do smaller, quicker appointments and make the whole thing a little bit easier. And so I think if you don't have that ability, can you just kind of figure out kind of how do you make sure that you get to what you need very quickly, you know, and like what's the priority? But in terms of a systems, I mean, I would love to see the kind of complex care model we have that's coming down first. Mental health would be amazing for complex care. So the complex care model for mental health is sort of like you have the primary doctor, maybe your GP or pediatrician, then you have psychiatry, and then you have therapy, and that how do you, when we're managing mental health, how do you kind of all work together? Because sometimes, again, the therapist isn't talking to the psychiatrist, is not talking to whatever, and everyone needs to be coordinated, and so this is a kind of a new thing that's coming in terms of it's a specific model on how to take care of mental health patients, and I think that would be great for complex care. Like if we had some sort of collaborative model that, you know, or a way to kind of help so that way maybe you don't have to take as much of the doctor's time and you can have more support staff, more nurse practitioners or nutritionists or somebody else to kind of work with you to kind of help manage that. I think would be a nice, but it's a hard question for me.
But you know what, sorry, just to hop in, I think it also too, like the patient, I'll speak from the patient perspective, but I know as a caregiver, like you need to go in organized. Like some of the onus has to be on the patient. If I know that I need to talk versus I need action, I'll book a longer appointment, but like I go in with a one-pager. You know, I think we have to go in and being very respectful of, I'm a human being and I've got all of I am complex, but I also respect your time. And so here's my top 3 priorities, or here's the most urgent thing. You know, have a one-pager, I'll plug me, Joe, for your one-pager for your kiddo. This is up to date, this is my big problem, this is what I need action on, right? Like, I just think we have to collaborate and work together.
And I think from a systemic standpoint, just from my experience in the UNC healthcare system, I think change needs to happen systemically, and we're not doing it just for rare disease. I don't think we're just doing it for chronically ill pediatric patients. We know in our team, when we started working with a complex care team, there were 3 doctors. 5 years later, now there are 7 doctors, and right across 7 miles away from us is the Duke healthcare system, and we just found out that their complex care team has a 200 patient waiting list. That's how many patients need care. So I feel like as advocates, if we're being in the hospital system that often, then we need to go speak to hospital management. There are patient family advisory boards, get on them, you know, be the change. And we've done that, and we now have expanded the team, and that's still not enough. So they've added more nurse practitioners. But one of the things I said is we're gonna talk to the genetics team, because they have specialty clinics, but they don't have any house for anyone who doesn't fit like an DMD clinic or an SMA clinic. And so I said they're the ones that need to now basically drive the force to hire more complex care doctors or expand the team so that anyone with a genetic diagnosis or an undiagnosed person can be referred to the complex care clinic automatically. So they don't have to wait years before even finding out that this system exists. And so I think systemic change needs to happen for you to really feel the impact, and it can happen in your care if you just go to your hospital administration. Not simple, but doable.
Yeah, thank you. I could talk to you all day. Pick their brains if you want to follow them around later and ask them questions. They just have a lot of really niche skills, and they're all so talented. I hope that maybe you do that. You make that one sheet, you make that checklist, you think about the questions you want to ask your pediatrician instead of just order them around like I do. But think about ways to be creative and get involved. Parvathy mentioned joining a parent advisory board. Every system has one, and you can just stalk them and email them and tell them that you're interested. Because a lot of the time they're searching for those families and they're not necessarily hiring the right ones. And yeah, she also mentioned MyMejo, and I see Ryan sitting right there. That's a really great tool to take down. So every parent with a child with a rare disorder, download that app, and that's gonna help you go into your office and talk to your pediatricians. So thank you so much for joining me, ladies. I'm really thankful for you, and I hope you have a wonderful day.